So I want to take a little bit of time to talk to you about the drug called adenosine. Your doctor is going to use it for a number of heart things, and it'd be important to kind of just know how it works, what they're going to use it for, and most importantly, how it's going to make you feel. So adenosine is a class 5 antiarrhythmic. You don't really need to know stuff about that. Pregnancy category C. The way it works, or the things that it does two major things. One, it causes transient heart block. 2, it vasodilates. So with the heart block, what it essentially does is that it starts up adenylate cyclase, it inhibits adenylate cyclase, and it results in cell hyperpolarization by K efflux. So it kind of forces K to leave the cell, and so because there's no K in the cell, you're unable to really use action potentials correctly. As a result, you can't really conduct your electricity from the sinoatrial node. So you can't really conduct your electricity from your sinoatrial node, to your AV node down into your ventricle. So it doesn't really conduct as well. Secondly, it vasodilates, and how it does that is also again through adenylate cyclase, but this time it causes A2 stimulation, which stimulates adenylate cyclase within the artery walls. The way that they kind of manipulate this, though, is that it causes dilation of only the normal segments of a vessel. If your vessel has atherosclerosis, or if it's like covered in calcium and whatnot, it will kind of it won't dilate that stuff. It only dilates the healthy stuff. And so there's this thing called It's like coronary steal syndrome, where if you administer adenosine, what ends up happening is that you vasodilate all the healthy stuff, but as you can imagine, all the areas that are kind of diseased or ischemic, you don't get any blood to there. And so instead of, for example, let's kind of use this heart. Let's say this area is stenosed. There's a little bit of calcium going on. If you can imagine, we give this heart adenosine. Everything else, so all the vasculature around it, dilates, and tons of blood enters this. This, however, will kind of be left alone. So all the blood that, kind of forces its way into here all comes into the other areas of the heart instead of where it was stenosed. And so this part's going to get even worse. It's going to feel even more ischemic. Luckily, it's transient. I've been told that it kind of feels like a donkey kicking you in the chest, but it'll go away eventually. All right, and so because of these features, you can use adenosine for supraventricular tachycardia. You use it for cardiac stress tests, fractional flow reserve studies, pulmonary vein isolation procedures. And so the stress test is essentially what we were talking about before, about how it vasodilates. The adenosine is used to test for blockages by exaggerating the difference between the normal and the abnormal segments. Kind of just like how we were explaining before. For pulmonary vein isolation, adenosine is kind of cool in that it unmasks dormant conduction foci. So by stopping conduction through the heart, it kind of gets all the weird little areas within the atrium to kind of go. And so if you get it to kind of go here, or if you get the SA node to stop firing or kind of block conduction through here, you can kind of force the atrium to kind of show itself. And so you kind of know where to ablate if the pulmonary veins are the reason for your AFib. Adenosine is used in ACLS. It's used in SVT cardioversion just because it kind of puts the heart into asystole. So transiently at least, so you kind of stop the conduction of electricity from the atria to the ventricle, and you kind of give the heart a chance itself to restart normal sinus rhythm. And then FFR, so FFR, it's also known as fractional flow reserve. It's the ratio between the maximum achievable blood flow in a diseased coronary and the theoretical maximum flow in a normal coronary artery. I don't really know what it means, but all I do know is that you need to use adenosine to kind of do this study. You probably have to come in and ask Dr. Ben-Zur how it works, honestly. So the side effects of adenosine, facial flushing, temporary rash on chest, lightheadedness, diaphoresis. As you can imagine, because of the whole blockage of the electrical signals as well as the vasodilation, you're going to get a lot of those kinds of symptoms. Metallic taste is a hallmark side effect of adenosine, so it tastes a little bit of metal. But it's important to know, and it's important to tell your patients as well, that these effects are transient, usually only more about a minute. And I'm going to read this here. It is classically associated with a sense of impending doom, or just more just kind of like an apprehension, like, oh crap, I'm in trouble. You know, if you're gonna push adenosine, which it generally is pushed as an IV bolus, you got to tell your patients, hey, this lasts for a few seconds, and it's gonna suck, but it's gonna go away. So yeah, that is adenosine.